Hello, Grayson College faculty. This is Leon Deutsch, the Director of Teaching and Learning. And in this video, I want to tell you a little bit about formative and alternative assessments. I just want to talk a little bit about your course and the assessments that you have. And in order to do that, I'm going to demonstrate for you how I took a basic medical terminology course that I started teaching about 13 years ago. This was a course that only had one type of assessment, and over the course of 2 or 3 years, I was able to add several types of assessments that made it a more robust, engaging course. It also allowed students to demonstrate and apply their knowledge of medical terminology. So first of all, just think for a second, what are the types of assessments that you use in your course or the different courses that you teach? We probably all have things like multiple choice tests, research papers, maybe your students do a presentation, and there's probably some type of homework. Those are all pretty basic, and we've all used those in one form or another. Now, this is just a comparison of two different courses. So we could say we took this from the syllabus, and on the left side we have a course that really only has 3 assessments. We've probably all taken one of those. I remember my very first class in college was a history class. It was during the summer, and we pretty much had 3 tests, and that was your grade. On the right side is a course where there are many different assessments built into the course with various percentages. I think a lot of students appreciate this because it gives a hardworking student the ability to build up their grade as they go along. And also, if they do poorly on 1 or 2 things due to not understanding the material or to other things that come up throughout the semester, it doesn't make it a detrimental course for them. One of the things you'll notice I have listed here, what I've done in some courses, I've had what's called a buffer test. It's an extra test that students can take at the end of the semester, and I will allow that to replace one of their lowest scores in the course. So that might be something you might want to consider in the future. So when we take a look at the whole semester, we want to think about how well do we balance out the different assessments throughout the semester. Does your course have the majority of its assessments after the midway point? Or are they more evenly spread out so that the student pretty much has a good handle on what their grade is throughout the 16 weeks? So I want to give you an example of medical terminology, which is something I've taught for many years. And I feel like this example can be applied to just about any course. So when I was in the military, I was getting ready to go to my medical corpsman training in California. And about a month before I left, I received a packet in the mail at my unit in Miami, Florida. And when I opened it up, it was just a stack of papers stapled together, and it said medical terminology. And the instructions were to fill this entire packet out and memorize it, because there would be a test the first week of school. And that's pretty much what I did. So for the next 4 months, I was in medical corpsman school. We never had any other official training with medical terminology. We were just expected to know it. And we were tested on it periodically. Now, a few years later, when I started teaching, I pretty much started teaching in the same way that I was taught in the past, which is what I hear from a lot of instructors. I teach the way that I was taught. But what I started learning early on is this was not effective for helping the students to learn the material, and it wasn't effective for helping me to understand whether they could grasp the material and use it. So I realized early on I needed to be creative. I needed to have a variety of ways to assess my students. And what I started thinking about is how can they apply this knowledge to the job that they're training for. I decided my assessments should be based on real-world tasks that they're going to complete out there in the field. So one of the things I had my students do in medical terminology is they had to create a short story about a fictional patient. And I would tell them, your patient has to have 3 different medical conditions. And for each medical condition, I want you to use 10 medical terms to describe their condition. The terms need to make sense. I don't want you to just list them in a sentence. I want you to use them throughout your paragraph, and make sure it's all tied back to that certain condition that the patient has. So this would help me to determine whether or not they understood the meaning of the terms and if they could relate them to the medical conditions of the patient. Another thing that I did, and it surprised me in the beginning that my students really enjoyed this, is I had several different role play activities. They would write a script. I would put them in groups of 3 or 4, and they would write a script. It could be, in one situation, there was a nurse or medical assistant talking to a patient on the phone. In other situations, there was a doctor and a medical assistant and a patient in an exam room, and they were talking about the patient's situation. So every time someone spoke, they had to use a medical term. And each person in the script had to speak at least 10 times. They also had to hand me a typed script before they got in front of the class to present that, so that I could mark anything that needed to be corrected when I did a follow-up with the students. Another thing that was very important and is a very practical part of the job is I would give them sample medical reports. And they would have to go through those medical reports, highlight each medical term, define it, and then type a summary in their own words describing what was the patient's condition based on their knowledge of those medical terms. Early on in the course, they could use their medical terminology book or a medical dictionary, but as we moved further throughout the course, they were not able to use those resources anymore, because the point was to get them to where they could interpret that information based on their knowledge. Another thing that was important is pronouncing the terms. I didn't want them to be embarrassed in front of a doctor if they did not pronounce a medical term properly, and I also wanted them to appear as competent in using these medical terms. So each week I would give them a list of about 20 medical terms for the week. For the first couple of days, I would pronounce the terms for the entire class. Then I would tell them, now you're on your own for the rest of the week. You've got to work with each other. There's online resources that will help you pronounce these terms. And then on Friday, because I had these students all day, every day throughout the week, I had time on Friday to take them aside one at a time and do that oral quiz with them, where they basically had to run through the list. They had about a minute to pronounce all of those terms. I would then immediately let them know, as soon as they were done, how they did on the quiz, and I would show them any terms that they had mispronounced and give them an opportunity to pronounce it again, at least for practice. Another thing that was effective was from time to time to show a 30 or 40-minute video from a medical TV show such as House or ER. And it wasn't just a time to sit back and relax and watch something. There was a worksheet that went along with it. So you had to write down every medical term and then define that term and turn it in the next day. I also had my students do a PowerPoint presentation where they had to present a certain disease or condition, and they had to use a minimum of 10 medical terms in their presentation. And I would always tell them, make sure you completely understand the terms that you're using, because I would definitely have at least one follow-up question for every single presentation to make sure they truly understood the terminology that they were using. Also, with different instructor resources, you'll get things like a medical terminology bingo game or a crossword puzzle. And really, in any course that you're teaching, there are online resources that can allow you to build your own crossword puzzles or other worksheets based on the vocabulary or the terminology that your students need to understand. To make it a little bit more engaging from time to time, I would put a whole list of terms on the board. And I might have a class of 30 students, and I would hand the first student in the first row a marker. I would call them up to the board and I would define a term, and they had to pick the correct term that I was defining and circle it. And then when they sat down, they would give the marker to the next person. And many times when a student got up to the board and they were stuck, I would allow them to ask a member of the audience. They could ask someone else in class for help. But it got them up out of their seats, and it made it a little bit more physically engaging. I also continued with the multiple choice exams that we were giving, but I wanted to change up the questions a little bit, so I would also have questions that were a little bit more thought-provoking and would help me to realize whether they were just memorizing the terms or they could truly understand them. So I would have similar questions like these. I would say, for example, Laura arrives in the emergency room complaining of hematuria. The doctor orders a lab test. What does Laura have? So they would have to actually write a sentence telling me what hematuria is. Just a few other things that I've done in different courses. In a pharmacology course I taught, students had to learn how to write prescriptions. So we would do oral quizzes every week where I would stand in front of the class and I would tell them, you're prescribing Zyrtec 10 milligrams and the patient's going to take one tablet by mouth twice a day. They would have to write that using the abbreviations that are used on a prescription. So they would be required to do that. I would also do contests in class where students would come to the board at the same time, and I would verbally give a medication order. They would write it on the board as a prescription, and the first one that wrote it and put the marker down would be the winner. And so I was able to divide the class up into teams to do that. My students would also do resumes where they had to prepare a resume for their medical office administration course, and I would take them to the computer lab and have them start the resume, print it, bring it to me one at a time, and we would review it and then send them back to the computer several times to make changes. To me, that was much more effective than having them just turn in a resume and I grade it at a later time. When I was teaching the skeletal system, I would have a skeleton in front of the class. I would bring students up one at a time. When they walked up to the front, I would hand them a sticker with a name of a bone on it and see if they could label that bone. So that was much more effective than just having them memorize the bones and fill out a picture at the end of the week on the test. So there's many advantages to using alternative and formative assessments. They don't always have to be graded, but I think it gives the students a great opportunity to apply the knowledge and help you understand that they are comprehending it. Thank you.